Hey guys, Trisha here. I am doing something a little bit different today. Instead of throwing a PowerPoint or a PDF at you for education, I am going to go over our activity and mobility via a Zoom, which we'll probably have to convert to a YouTube video. But anyways, I'm hoping this is just doing something a little bit different here, so bear with me. I'm going to share my screen here. If I can, there we go. Okay, and let me pull up. So you should have the John Hopkins Activity and Mobility Daily Goals poster. It's a laminated poster in everybody's room. So it should be in each patient's room. And probably or hopefully close to the whiteboard because it should be kind of part of what we're doing with all of our patients, whether you're day shift or night shift. So let me just talk a little bit about this. The point of our mobility chart is to get the patients up and moving and increasing each day so that they are as close to their baseline mobility as possible by the time that they leave in our discharge. So when your patient comes in, you're going to write down the date, the day's date, and then their baseline mobility score, which is right up atop here. That's going to be what they were doing prior to being admitted to the hospital. So if they were walking 250 feet, then that would be their mobility for their baseline mobility. If they were only maybe sitting on the side of the bed, then that's their baseline mobility. So we want to document that stays the same throughout their stay. Now, on night shift's going to determine what the goals are for the next day. They should be increasing each day. So if the patient was sitting on the edge of the bed the day before, then the goal should be at least transferring to the chair or the commode the following day. So yesterday's goal is going to be in this column here. So we're going to write down what yesterday's goal was. And then today's goal, or yes, I'm sorry, not yesterday's goal. Yesterday's highest mobility score. So whatever they did the day before goes into this column, and then today's goal goes into this column. Okay, so that's night shift. Day shift, twice the patient needs to ambulate or do some activity to the max of their ability, hopefully hitting at least that goal for the day, or doing a little bit more is fine as well. And what we're going to do on day shift is tally mark each time that they get up and they do that particular activity. So if their goal is to transfer to the chair commode and they do that twice, and then maybe they do a static standing for a minute as well, you would tally that in this fob spot as well. So at least twice a day. This is in addition to what PT and OT does. Okay, so let me bring up my PowerPoint. Okay, so why are we doing this? Why is it important? Well, our evidence shows that when we get our patients up and we're moving them as frequently as we can, it's decreasing our length of stay, decreases chances of delirium, definitely decreases mortality. And we also are hopefully decreasing the risk for pneumonia, for pressure injuries and whatnot. And the more they move, the quicker they get out of here, right? So that's the reason why we want to try to increase their mobility each day. This is what it's going to look like in Epic. It's in the daily cares and safety flow sheet, and it's under activities. So you have your mobility down here, and right on top is your mobility goal, which is what night shift will document. And then our mobility scores, which what they do max each day. So we'll document that as well. Nurses and or NCTs can document the score if our nursing care techs are getting our patients up, walking them to the bathroom and back. They have this in their flow sheet as well, so they can document that as well. So we're trying to get them to their maximum capacity at a minimum of twice a day. And here's kind of what it looks like in terms of the goal our night shift's going to do. So if their goal is to move to the chair commode, we're going to put a 4 in there. If their goal is to sit at the edge of bed, we're going to put a 3 in there. And our day shift is going to document in the mobility score. So if they go to the commode or chair, then we put a 4. Again, if they sit at the edge of bed, we put a 3. So each time that they do that, you want to document in the mobility score. And then we can also document kind of how they tolerated that particular activity. Did they tolerate it well? Did they tolerate it poorly? Did they get up and walk and their oxygen, saturation decreased? Were they really unsteady on their feet? So those are some things that you can document. You can whether they tolerated it well or not well. And then others, if you have some comments about what happened during that, we put those comments in there as well. Okay, so again, this mobility chart is in the patient's room. And the reason why we have this in the patient's room is because it's a visual cue for them. And it's a talking point so that we can get the patients up and moving. But this is also a team effort. So the provider team should be utilizing this as a talking point with their patients as well. They want to know if their patients are getting up and sitting in the chair. They want to know if their patients are ambulating in the hall, because if they're not, and they should be, then they can have those conversations while they're rounding. So again, important to keep that mobility chart updated each day. Make sure that we're ambulating at least twice a day to their max capacity for that day, and then getting that documentation in Epic in the chart. And then if you have any problems, or if people are really not mobilizing, then that's a conversation to have with the provider team. You could also bring that up with the nursing leadership if patients are refusing to get up and get moving, so that we can come in and have those educational and talking points with those patients as well. Okay, so I'm going to stop sharing here, and I think that's it. I hope this was helpful and informative, and if you have any questions, just let me know. I'm always here. Thanks. Bye, guys.